Have you ever wondered in your pregnancy just how big your baby is? Have you ever been confused when someone says to you at a doctor's office or your OB provider's office that your baby measures at a certain percentile? Can that be confusing? It definitely can be. So today I want to go through with you evaluating exactly how big is your baby. Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal fetal medicine specialist, which just means a high-risk pregnancy doctor, and today we're talking about how big is my baby? Before we get started, there is a link that will be provided if you want to look further into kind of how big is my baby and understanding what an ultrasound is looking at when it's estimating the weight of the baby. And also you have the availability for a download that we're going to talk about during this session today that talks to you about how to interpret and understand an ultrasound that's estimating the weight of the baby. So it can be a very, very confusing topic to go through to figure out exactly how big a fetus is during a pregnancy. And so we're going to go through that today. So as far as a little bit of expanding your knowledge, what I would like to go through first is a few definitions here. So the first thing to understand is, what is your estimated due date? And remember, your estimated due date is when you are meant to be 40 weeks along. So once you know your estimated due date, you then can calculate your gestational age. And so if at a certain gestational age you have an ultrasound performed, the ultrasound will then explain a lot of bits and pieces and details. And that's what we're going to learn more about today. So when you have an ultrasound performed and it's looking at the baby's weight, if you are after 14 weeks along, we do something called biometries, and I'm going to show you what this is. So I have a Barbie doll from a friend of mine down the street. Thank you very much, Dana. And I needed something like this that has bendable extremities here. So when you go in for an ultrasound and they're measuring the fetus, we can't actually weigh the fetus. So we're going to learn a little bit more about what biometries are, and you can also find in your downloads that you can look at an example ultrasound, and I've kind of written it out as to what the ultrasound says and what that actually means. So before we get into that, I want to go through a little explanation on what biometries are. So biometries are looking at different measurements of the fetus, and then those measurements are put into a calculator, and then it spits out a weight. So the measurements that we're looking at, we'll start from head to toe. So we first look around the head. We call that the head circumference. That's a measurement that gets taken. We also look at a side-to-side measurement, so side to side of the head. We call that a biparietal diameter. Okay, so those are the two measurements of the head that we take first that's going to ultimately give us an estimated fetal weight. All right, then we look at the upper arm bone, and we try to get it as parallel as we can to get a really good measurement of it. If the baby's arm is kind of like this, you can tell that somebody looking from up top with an ultrasound can't really get a good measurement. So you'll notice that they try to get the bone like this when they're looking with an ultrasound. So this is the humerus length, so the upper arm bone length. Then the next thing that we're looking at is around the belly. We call that the abdominal circumference. Okay, so we take a nice measurement around the entire abdomen for the baby. So that's the abdominal circumference. And then the final measurement that we look at is right here. And this is the femur length, okay, the upper leg bone. And sometimes ultrasound reports, they actually won't measure the upper arm bone. So they'll just do around the head circumference, the side to side, the BPD or the biparietal diameter, the abdominal circumference, and the femur length. And from those 1, 2, 3, 4 measurements, they will go into this calculator, and then it will spit out an estimated fetal weight. And it'll come out in grams, and then they'll convert it over to pounds and ounces, and that's what you'll see in your report. So if you go to that download too, you can see some examples. So I'm going to pull that up here and share that with you so that we can go through that together today. So when we're looking at the report, you first can see kind of what the report says at the top, and you can see GA, which means gestational age, and then EDD, which means estimated due date. So we're saying by your estimated due date, your gestational age today, in this example, is 33 weeks exactly. And then to the right of that, you see GA, AUA. And that means what is the actual ultrasound age from the ultrasound that's performed right now. And here it says 33 weeks and 6 days. So what this says to us is that today the fetus is 33 weeks and 0 days. based on your due date that we're using. The ultrasound today estimates the baby's size today is right at 33 weeks and 6 days. So it doesn't mean that your due date is changing. It's just telling you, hey, this is how many weeks you are today. This is how many weeks the baby appears to measure today. And that's the overall information. And remember, that information came from these biometries that we talked about, right? So then you can see what the report says. You'll see a BPD, which remember is the biparietal diameter. Then you see a head circumference, which is around the head. And then you see the abdominal circumference and the length of the femur. Each of these lists as weeks and days. It also lists as the percent. And so what you see to the right is something called Hadlock. And Hadlock, remember we said that it takes, the ultrasound machine will take all these numbers that we looked at, around the head, side to side, around the belly, the upper leg bone, and then it puts it into a calculator. The calculator uses this formula. Most often it's called Hadlock. And then that's where you ultimately get the weight for the baby that comes out in grams and then gets converted to pounds and ounces. All right. When we're looking at this as well, you'll see each measurement has the actual measurement in centimeters. And then you go further to the right, it tells you in weeks and days, and then in percents. So as you can see here, we have a biparietal diameter that's 34 weeks and 2 days, and that's around the 80th percentile. Because remember, this fetus today is 33 weeks. So the biparietal diameter measures a little bit bigger, okay? And then you can see down at the abdominal circumference, it's 32 weeks and 5 days. That's at the 44th percentile. Any of these percentiles, for the most part, if they're between 10 and 90%, are considered normal, all right? So then let's go down to what it says next. Now we have the estimated fetal weight in grams, and then it converts it into pounds and ounces for us. So we've got 4 pounds, 12 ounces, and what it says is the baby today measures around 33 weeks and 6 days, which is the 61st percentile. So the way this reads is you are 33 weeks pregnant today. Your baby measures as a baby that is right around 33 weeks and 6 days. So for a baby that is 33 weeks and 0 days, which is what you are today, your baby measures at the 61st percentile for a baby that is 33 weeks gestation. So many numbers, so many percents, super confusing. I hope this kind of helps a little bit to explain it all. And the overall take home for this is if you have an overall estimated fetal weight for the percent that says your baby is at the blank percentile, if the blank percentile is between 10% and 90%, then the estimated overall fetal weight of your baby is considered normal. Now that we know some background, a couple of questions that you can ask now that you know a little bit about biometries and how we check the weight of a fetus. And again, remember, these biometries are anytime after 14 weeks gestation. Prior to 14 weeks, it's a different story on how we look at the baby's size. After 14 weeks, we use those biometries. So questions that you can use and ways in which you can develop skills to understand this better and talk to your provider. Number one, ask and clarify your EDD, or your estimated due date, early in the pregnancy. That's the number one thing. Make sure you know what your due date is so that as you move forward, you know exactly what you're looking at and how many weeks you are as you progress. Second thing, ask about the size of your baby. Oftentimes, physicians, OB providers, they will measure your fundal height. And so they do that in the office just with a measuring tape. And that can be something very easy to be done in the office. And then if they perform an ultrasound to check on how big your baby is, that's where a lot of these questions might come into account as to what percentile is my baby in, how many pounds is my baby today, how many grams, those kinds of questions that we went through today. Finally, ask if there's any follow-up. If there's anything needed to do after an ultrasound is performed, ask your provider if there's any follow-up needed or if there's anything different that needs to be done with regard to follow-up and checking the baby's growth or the size at any future point in time. Finally, the impact that we're having right now. So first off, learning the definitions is fantastic, and being able to ask your provider questions to advocate for the understanding of the size of your baby is so important. The other thing that's wonderful is you're gonna probably know, or at least be able to predict a little bit, how much your baby is going to weigh at the time of birth. So fun little fact, when you hit around 34 weeks gestation, babies gain about a half a pound a week. So that'll kind of help you to decipher, understand that as well. Quick little wrap up and review of everything today. We expanded our knowledge and learned some definitions surrounding the estimated due date, your gestational age, and we learned what biometries are and all the verbiage that goes along with that, and estimating the weight of the baby. We have developed skills to ask the provider, hey, how much does my baby weigh? Are we doing this with fundal height measurements? Are we doing this with an ultrasound? And also asking if there's any need for different follow-up dependent upon what the fundal height shows or what an ultrasound shows for your baby's weight. The amazing impact that you're going to have on yourself and your pregnancy is knowing how to interpret this ultrasound a little bit, how to ask the questions, and how to ask if you need any particular follow-up so that you can have a healthy pregnancy and ultimately try to understand a little bit more about how the weight of your baby is estimated throughout your gestation. Don't forget to check out the links that has more information about biometries in case you're interested in that, as well as the download on how to kind of look at an ultrasound and interpret some of the numbers. I hope that you had fun learning about estimating the baby's fetal weight today and really understanding what's involved in a growth ultrasound. And if you have any other questions or comments, please leave them below. Always interested to hear on any other topics that you want to hear about and any comments from today's video. I'm Dr. Lexi, wishing you a happy and healthy pregnancy.